Hey guys, it's Kate. Welcome back to my channel. Today I wanted to talk to you about what's in my clinical bag. So this is my clinical bag. I take it to every single clinical I have, whether it's lab on campus or actually at the hospital. And I got it from an Etsy shop called Shop Simple Joy, and I'll link it down below. She is fabulous. She has all different designs here. And then she personally embroidered this in the color I wanted, how I wanted my name spelled, and then also I wanted the codicus. And as you know, I really like pink. So I went with the pink. My school scrubs are gray, so I went with this gray design as well, and I thought the mint just really accented it well. It has two main pockets, the one on the top, which is just one big pocket, and that's where I keep like all my stuff in there. And then there's a little pocket on this side that's in there too, and then you have a mesh pocket for like water bottles, and then another pocket on this side for whatever else you want. So I'm just going to show you kind of what I keep stashed up in here. And yeah, let's get started. So in the front pocket, I just keep like a bunch of like random things like pens, a fork, because I always forget forks for some reason, so I always just carry one around with me. The little hard set of ears for my stethoscope. Phone charger. These things are crucial. I really like this one from Costco. I just plug in my USB port and it's awesome. And then I have chapstick galore. This is my clinical bag chapstick because I have a clinical bag chapstick, a backpack chapstick, a bedroom chapstick, a car chapstick, my second backpack chapstick, my purse chapstick. I need chapstick in my life, and if I can't find it, I get very upset. So I always keep one everywhere, and if I ever have to like change one out, then that's a problem because it's like, well, then I just put my car chapstick in my backpack, so now I don't have a car chapstick, so what do I do? I'm working on it. And then I also carry around like tampons and important girly things in there. So in my little side pocket on the side here, I have a carrier for my hemostats and my, and like tweezers, and also my scissors, but the problem is right now is I don't know where I put my scissors. So they didn't make it back into their home. So that's why homes are important for me. Oh, I found little scissors. My big scissors. I don't know where my big scissors are. Inside, I've got this little organizer. And I really like it. I got it on Wish for $1. And you can also get it on Amazon. It has one main pocket in the middle, two zipper pockets, and then like just a crazy load amount of zipper pockets on the sides. So let's go through that. So in my pockets, I have, on this side, I have lotions. So this is the lotion that's actually approved by my hospital, which is really important to stay on the hospital's lotion because it'll interact with the antibacterial gel that they have and is safe for the patients. These are the lotions that I like to put on after shift because they smell really nice and it kind of gets the hospital smell off of me. I also have a comb because my hair's too short to brush, so why even bother? It's my pen light. I got it on Amazon. It also has a sister pen light, which is hot pink. I really like it. It has the pupil size, and then it also has a ruler over here. I keep a bunch of spare band-aids in here, just in case something happens while I'm out on the floor. These are also hospital brand approved band-aids. So I have an extra little thingamadobbles, which is for my badge. I am dual enrolled also at Lewis Clark State College for my bachelor's, and so they gave us that. Over here, I have a piece of sterile gauze that ended up home with me because it was in my pocket. I have alcohol swabs galore in here. Like, these are just everywhere because as a nurse, you're carrying around so many alcohol swabs because of finger sticks, just cleaning up a wound maybe, cleaning off tape. Alcohol is great for cleaning up any kind of gooky thing. But everywhere. So I carry these come home with me all the time, and my husband always jokes around with me. He's like, oh great, laundry day. It looks like we're gonna find like 500 more alcohol swabs. I'm like, sorry, not sorry. At least I'm being conscious. And then on the other side, I keep my driver's license and a credit card in here. When I'm on clinicals, I'm about to go to clinicals, so I just keep them in here anyways. I have a little hand sanitizer here as well. This one I just got from Winco because it was super cheap and I needed one like on me at all times, so I have one attached to my backpack. This is one here. This is like chapstick for me. I have one in my backpack, one in my car, one in here. When you're working around so many sick people, the amount of hand sanitizer you go through is slightly ridiculous, but better safe than sorry, right? Also in here I have my coffee cash is what I call it. I give myself like $10 a month to allow myself a little fancy coffee if I want to. I keep my coffee cash in my clinical bag because my clinicals start at 6:15 in the morning and I am not a morning person any way, shape, or form. And so it's nice to get up early, kind of slowly work through things, and then stop by a coffee stand on the way there. There's also a coffee stand in the hospital, which is awesome for those days when I'm running late. On this side I have another comb because, like I said, short hair, you just like to spruce it up a little bit. No, that won't be. Whatever. In here, and then talking about the coffee, here's my coffee card. So that's what's in the outside pockets. Oh, and then I also have, this is terrible, I'm just gonna check that. I have pencils. I usually have pens, but for some reason I lost my pen last week and gained a Sharpie. So I have 2 Sharpies in here, and Sharpies are important for when you're like putting name and date on a wound dressing or on an IV pole, like anything that really needs to be dated, you need to do it in permanent ink, and I just like to carry around a Sharpie for that. In the middle, I have my badge for school, which is kind of fun. That's me, but it don't really look like me no more. My clinical instructor last semester gave us gold stars. So this one I have a gold star on, and then my actual badge that I have for like clinical that has the access to the hospital stuff has like 20 more stars on it, but they're slowly like turning into silver and stuff just because of how many times you're like, gotta do it, gotta do it, gotta do it, gotta do it. And then I also have a sepsis criteria card on here that one of my teachers gave us, just to kind of, because sepsis is such a big deal in the hospital, trying to keep people from getting sicker, that just by following these things, I can kind of see like, is this person kind of going down the drain and how can I bring him back up? Last semester I was on the night shift, so I got this little clip-on light. It has really bright red and then like a flashing red because it's really for runners. But what I used it on the red, and then I would put a sticky note kind of over it, so that way when I was in patients' rooms when they were sleeping, like the last thing you really want to do is wake them up when they're trying to get some rest, because rest is so important to healing. So I would just take this in and then just kind of check the wristband, just scan the wristband real sneaky like, and then scan the bags, and then everything goes cool, and then just sneak out. And it was a lot easier with this than turn on the whole light switch. I also have some netting. These are just things that kind of like ended up in my pockets on the way home and I realized already. So I have that. I have an IV start kit, like in new IVs, because these are the new IVs that they just started at my hospital, and my lab instructor gave everyone 2 of them to practice with, so I just keep one in here at all times in case I'm on campus in lab and I want to practice one. And then I have tape, which is important for life. Oh look, more alcohol swabs. These connectors are also part of the new IV system, so that's why I have them in here. I also keep my stethoscope in here. It is a Littman Classic 2, and it's in pink, which I love. Got the Littman there. I am not sure how I feel about the stethoscope yet. I'm still kind of trying to figure out how to listen to breath sounds and heart sounds anyways, and this always gives me a little bit of problem. I don't know if it's because of my hearing or it's because of the actual tubing. I will let you know. I'm kind of looking into getting like an MDF, which is another brand of stethoscope, but for now this one works just fine for me, and once I graduate nursing school, maybe I can hint hint, nudge nudge one of my family members to graduation get me a fancy one, like a cardiology one or something fancy like that. Just saying, howdy. So I have that in there. Some people keep them in the actual box that it came with, but I just don't want to carry around the box, and it fits so perfectly in this little side pocket here. It's important to keep it safe and not like scratched or dented. And then in my other pocket I have a watch set. In my other pocket I have this watch, which my mother-in-law gave me a few years ago, and I absolutely love it because look, it's Minnie Mouse. And it's pink. It's pink and it's Minnie Mouse. It also has the second hand that moves, which is really important for taking the pulse, doing my sprays. I wear a Fitbit right now, which is actually charging, which is why I don't have it on today. But it turns off after 10 seconds, and so it's not really beneficial to me, but I've started to learn that in the hospital I can wear the Fitbit and just use the patient's clock that's in their room, because the patient's clock has a ticking second hand. It's just very smooth, because sometimes I count the bumps rather than what I'm actually feeling, what I'm actually hearing, things like that. So that's why I always carry one of these around just in case I need it. And then I also have a bunch of saline flushes, because yet again, these are the things that I accidentally carry home in my pockets. They're also really fun to squirt the dogs with when they're being bad. So that's everything that's in my little organizer. What's really nice about this is pretty much the heart and soul of what I take into clinical with me. So if I need to on the run and not take my big bag, I just grab this. It has little handles. So it's like an Insta bag, which is kind of nice. And I really like it. Another thing that I really enjoy having in my clinical bag is my clipboard. So this is a nursing clipboard. And it has all the shot sites, labs, and how to read them, because a lot of physicians will use this this way of doing labs. How to read an ABG, if you're going into metabolic acidosis or respiratory alkalosis, different gauges of IVs and why you would need it. For 18 gauge, you would use it for blood. For a 24 to 26, it's little tiny shots, or for neonates. And then on the other side, this part's really important. Conversions. Oh, all the lovely conversions, because in America we don't go by the metric system, but everywhere else in the world does, so it just makes sense to put medical records into metric. So what I like about this is you have the temperature, the height, and the weight all in metric, and then convert it into English as well. And then I really enjoy heart stuff, so this one's actually really nice for me, because it has the QRC complex, how to recognize a STEMI. You also have pupil sizes. And then there's 2 rulers on here, which is really nice, especially when you're measuring wounds, that you need to know okay, this way is this much, this way is this much, things like that. And then my husband was really awesome, and he etched my name into here when he was at work. And then it just opens up, and I keep all my important documents, my brain, which is kind of a nurse's way of writing everything down and making sure that she has it, so she's not just pulling it out of her head. And then I put sticky notes on the back, and each sticky note represents a patient and their med times. That's just how I organize that. Also in my bag, I keep a lint roller. Like I said, my school scrubs are gray, and in second year we wear white tops. I have 2 black dogs and 1 white dog, so without fail, I have dog hair somewhere on me, as you can see by how nasty and gross this is. But it's really important to show a professional appearance, especially when you're a student, because you could probably get a job there and they might remember you from when you were a student. And you need to make sure that you make a good impression now, and also you're representing your school. So I always keep this on me, and I have a Tide pen as well, but I keep that in my car because I spill on all of my clothes and not just my scrubs. And then also in here I have headphones for when I'm taking a break, or when I'm off the floor and eating lunch and just kind of want to be to myself. I just put some headphones in and listen to my lecture, or listen to a podcast, something that can help me study. And the last thing I have in here is another fork. Surprise, surprise, Kate has a fork. Yeah, so this is my bag, and I take it to clinical with me every Monday, which is for this semester, which is a 12-hour shift, and it's awesome. I just stick it in the locker room and I'm good to go, fill up my pockets, and at the end of the night I can just dump it all out in here. Another great thing about this bag is that it's washable. It's washable. So it's awesome because I get stuff all over it, and then sometimes my dogs like to lick it or pee on it or just stupid things. So it's really important to have something that was washable. Please leave a comment down below if this is something that you like to see. Let me know what you keep in your clinical bag that might be able to help me as I progress more into school and also into my nursing career. Other than that, be sure to subscribe to my channel. I put out new videos every week. And then also follow me on my Instagram at lyricalfitchick. I post things like lifestyle events, my puppies, nursing, and fitness. So be sure to check me out there. Other than that, I will see you in the next video.